In this video, I want to be talking about jumper's knee or patella tendinitis. So what actually is this pain that you're getting at the front of your knee? What causes it? But perhaps most importantly, the 4 things that you need to be doing in order to get rid of that knee pain. So let's go. Thanks for checking out the channel. If you're new here, my name's John, head therapist at John W Sports Injury. Here at this channel, we look to do 3 simple things. Help you to understand all about your body, what pain that you might be suffering and what's causing it, so that you can get rid of that to get on with your sport and exercise goals. So if you haven't subscribed yet and you've been checking out our content, why not subscribe now so I can keep you updated? But anyway, let's talk about patella tendinitis or jumper's knee. Firstly, what actually is patella tendinitis? Well, this sort of orangey-like structure that you can see here is your patella tendon, sometimes termed the quadriceps tendon. And that is because it is the tendon of the quadriceps or thigh muscles. Now remember that a tendon attaches a muscle or group of muscles to a bone so that it can perform its function at that joint. So in this case of the patella tendon here, this is the tendon of our quadriceps muscles. So our 4 big thigh muscles attach into this tendon and they come in and attach onto our shin bone here, what we call the tibial tuberosity. So patella tendinitis is typically experienced as a pain just below the kneecap, so perhaps at the top of the shin, or most commonly I find at the base of the kneecap. So if you're suffering with pain sort of coming across the top of the knee, in particular at the base of the kneecap, that's a classic indicator that you could be suffering with patella tendinitis. So why does this happen? Well, this happens because the muscles that are affecting this tendon might be having some dysfunction and ultimately applying too much force onto this area. If we imagine this tendon here that's crossing over the top of this knee joint or this kneecap, if I was to apply excessive force onto this area, it makes sense or stands to reason that it's more susceptible to some damage, particularly in the areas as it crosses that kneecap, sort of at the apex of the kneecap here. So this can be caused by multiple things, but typically some dysfunction in the quadriceps muscles, some tightness in those quadriceps muscles. That may have come about because of a lack of strength for the demands that we're putting through those quadriceps muscles. But let's not forget some of those indirect factors that could be having an impact. For example, if we have some underactivity or some tightness in the hamstrings at the back of the leg, they work as what we call an antagonistic pair with the quadriceps, which means that they have to work together. I often describe these as sibling muscles, which means that they need to work together in harmony for everything to be okay. So if we have problems at the hamstrings or if we have problems at the quadriceps, they will likely be having this effect on this patella tendon and create some dysfunction in that area. So to summarize what it is, it's this muscle, it's this tendon having impact upon it caused by the muscles that act upon it, typically experienced with pain around the base of the kneecap. You might be noticing the type of pain as you walk up or downstairs, performing activities like running or jumping, hence its common name is jumper's knee, but ultimately a soreness at the base of the knee. But that's enough about what it is. What's most important is that we tackle our 4 tips on how I think you want to be getting rid of this pain that you may be experiencing. In order to do this, I'm going to jump over to the bed and start talking through those 4 tips now. So the first thing that we want to be doing is to manage your symptoms. Let's not forget that this can be a very painful condition. So it's important, first and foremost, that we're looking to settle some of that pain for you. So using something like ice, this is typically an inflammatory or can be an inflammatory condition. So by using ice onto the base of that kneecap, what we will start to feel here is that will start to settle the pain. But that is only going to be managing symptoms. What we want to be doing most importantly is getting rid of the cause. So my second tip that we want to be doing is to be looking to assess the flexibility of those muscles that I mentioned earlier, in particular, those quadriceps and those hamstrings. Remember, the knee is often a joint that gets bad press. We blame our knees, but it means that it's being beaten up by another area. So what we're looking to do here is to assess the flexibility of the most likely problematic contenders to see if we've got any areas of tightness that we can start to get to work on. So how do we do this? Well, firstly, as I mentioned, the patellar tendon here is affected by the quadriceps muscles. So if we want to be assessing our flexibility, what we look to do is we look to lay onto our front, keeping our pelvis nice and flat. From this position, all we look to do is bring up our foot. Now, I would encourage you to start on the good side, the non-problematic side. And as you pull that foot up, what you want to be able to do is to grab hold of that ankle, keep everything in a nice straight line and pull that foot in towards your bottom. Now, that foot should be able to touch the bottom, telling you that you have full flexibility in that area. We can look to then repeat this on the other side. Now, what you might see is all of a sudden that doesn't allow for that activity to be performed. Here we can see, if this was my reading, that I've got a clear difference between my left and right hand side, and if this was my problematic side, that's our first indicator that we may have an issue or a lack of flexibility in that area. So the nice thing about some of these tests is we can then use this as a stretch. So if you highlight that you have that tightness in the area, then that's a stretch that could be performed daily. Looking to do that 2 to 3 times a day for about 30 seconds each. Now that can be a very difficult stretch. If you've tried this and you found that the foot can't get anywhere near your bottom, or you can't actually grab hold of that ankle, then that stretch might be a little bit difficult for you to do. Another thing to be aware of is it's very common to get cramping when you try things like this in the hamstring muscle, and that's indicative of a tight quadricep as well. So all these things point to the fact that you need to be working on your stretching of that area. But if that stretch is a little bit difficult, a modified version that can be easier to do is to lay onto your side. From this position, what you can look to do is bring the leg up and grab hold of the ankle. So what we can do here is get to a comfortable position, grab that ankle, and you may start to feel a quadricep stretch. But ultimately, what you want to be doing is keeping that position and bringing your knee down as close to below your hip as possible. But as you go through that range of motion, you'll feel start to feel those quadricep fibers engage. Once you feel the stretch, just hold at that point for 30 seconds. And hopefully over time, you can get closer and closer to getting that knee below the hip joint. Now, the other likely culprit or potential culprit in all of this, as I mentioned, is the hamstring muscles. Now, for our hamstrings to assess the flexibility, we can lie flat on our back. And then from this position, what we want to be looking to do is just to bring our leg straight up. Now, what you should be looking to achieve is keeping the other side flat on the bed or the floor, whatever you're lying on, and we want to get this to really aiming for about 90 degrees. I'm a little tight through my hamstrings, and that shows here where I'm just off of that 90-degree point. But what the two things you want to avoid is either a bend at the knee. As soon as we bend, that's very easy for me to achieve that 90 degrees, but we want to keep that leg straight. And what we also want to avoid is a compensation of just riding up on the other hip, because again, that makes that easier and not a true test. Again, we can start on the uninjured side and then compare to the injured side. So again, we can see here I have a lack of flexibility in my hamstring. That feels much tighter on my left-hand side. So that will tell me that that's another area that I need to address. And that can be done by just utilizing that stretch and holding it for 30 seconds. If you find that stretch to be sore, you can come in with either something like a cord, like a dressing gown cord to pull on the leg, or you can hold the leg and pull into position. But don't pull aggressively, just pull comfortably until you feel that stretch. So the next tip that we might want to work on is to look at some of the tissue quality of those muscles that are impacting on the knee. So we've spoken about those quadriceps muscles a lot because they are the muscles that are pulling on that patella tendon. So what I would encourage you to do is look around, push into those muscles, and you might find some particular area of soreness. And this is where some self-massage can work really well. And there's lots of things that you can use to do this. More and more popular that we see now are things like massage guns. They can work really nicely to work into those areas. So what I might do is I move the massage gun through is look for some of these sore points. If I find a sore point, a point of discomfort, and common areas, guys, are this outside of that quad muscle, all I look to do is just hold on that muscle point and then work that through to allow that all to relax. But having said that, If you haven't got a massage gun, this can all be achieved by using items like your hands to work into those areas, find the sore point and just hold on that sore point and look to relax that tissue as we work our way through. And so my first 3 tips were around icing to manage the symptoms, stretching in order to increase the flexibility and take some of the pressure that you might be applying onto the knee. Thirdly is we're looking to self-massage into that area, break up that tissue. Another great tool here can be something like a rolling pin or a massage stick that we can simply look to work through those sore muscles. And all of those things are designed to be taking some of the pressure off of the knee. However, what we ultimately know is that this tendon has developed this dysfunction due to a loading issue. We've been putting too much load through the area for the current strength of the area. So we know ultimately that we do want to prepare it to be taking the load that we want to put through it. So we want to be starting a strengthening program to prepare the tendon in order for the loads that it will receive ultimately when we're back doing our sport and exercise. So I think of this in the case of a patella tendon as really 3 phases. The first phase being a non-weight bearing phase. I'm looking to take my body weight out of the equation, but do some exercises to be using the muscles, using the tendon without my body weight. So these could be something like seated knee extensions. So what I'm looking to do here is have a seated position, back nice and flat, and I bring my legs up and back down. So here I'm starting to work these muscles. I can feel those muscles contracting, but I'm not yet putting my body weight through the area. If you want to make that exercise a little bit difficult, we can do that lying down. Now what we have here is the effects of gravity pushing down on us as we look to lift up, and that becomes a harder exercise, but still working those muscles, my quadriceps and my hamstrings, in order to prepare this area to be receiving that load. If you want to make those exercises a little bit more difficult, try it holding something like a pillow, cushion, or even some ankle weights to challenge yourself a little bit further. We want to be doing with any of these exercises about 3 sets of 12. If it's causing you pain as you go through, we know that currently that's too advanced for you, so either reduce the number or look to start on an easier exercise. Once we're comfortable with some of these exercises, some of these non-weight bearing exercises, we can then move into weight bearing. Now, when we move into weight bearing, what we want to be doing here is looking to not put too much weight through the knees. So what we can look to achieve here is what we call an isometric. Okay, so rather than going into a squat in its conventional sense, where we're looking to squat down and we're really looking to load that area, what we can look to do is drop into an isometric, which means we take the muscle under contraction and we hold in that position. But the advantage here is that we can only work in your pain-free zone. So if you know that you can start to squat and hit this point without pain, we can then just look to hold that under an isometric. We can hold that then for 10 seconds, come off, and then repeat, but making sure that we're not going to that point of pain. So we're getting the contraction of the muscles. We're getting the advantage now of putting our body weight through the area to be preparing these muscles, but we're not loading as deep as a full squat. And then the final phase is to go through that full weight bearing phase. So here is when we can take to something like a squat. So, and again, I would encourage you to start in your pain-free zone. And over time, over the days, weeks and months, you'll find that that pain-free zone is extended till we're able to go into a deeper squat and load up those knees. That's when we really know that we're managing to improve the condition, that we've got the tendon to be once settled down from its dysfunction and now ultimately to be stronger, which all in all is going to allow you to return to those sport exercise environments that you want to be doing with pain-free knees. Has that been helpful? If it's been helpful, do me a quick favour and smash that like button, because that shows me that this is the type of stuff that you want to be seeing, and it also lets others see some of these tips to help them with their knees. If you haven't subscribed, why not do that right now? Hit that subscribe button and I'm going to keep you updated as soon as we bring out our next video. So I'll see you there.